Good afternoon. I'm Pat Living with the Department of Health and Social Services, and I'll be your moderator for the COVID-19 update for today, Wednesday, April 22nd. Following a statement from the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley, we will go to the reporters on the line and in the room. As per our usual procedure, we'll work through the callers with one question and one follow-up. If we have time at the end of the session, we'll entertain additional questions. Thank you. Dr. Hanley?
Thank you. Good afternoon. Bon après-midi. Danacha. As of today, we remain at the same number of cases. All currently active cases are related to one family cluster. Contact investigations are still ongoing, and as mentioned, we still may see further COVID cases associated with this cluster. We have not found any significant public exposures associated with these cases. I want to bring up two observations I've made in communication with both the family involved and with the public health team in charge of the investigation. I understand there have been what I might say ungenerous social media postings about the involved family. I would like to say that we cannot and should not ever know about the circumstances around a particular individual and their family when experiencing COVID infection and its spread through a household or family contacts. Every case of COVID inevitably brings up new, unexpected, or atypical symptoms or presentations. COVID is an insidious disease that continues to teach us, surprise us, and humble us. Mix this particular viral infection with family circumstances that are as wonderfully variable and distinct as our crystals of Yukon snow, and you will begin to understand the complexities of teasing out and following a story of infection. What I can tell you is that this family affected is like any other that I have come to know in Yukon. Close, loving, dynamic, and thirsting like all others for respect and privacy. I would never wish to suppress the flow of social media or public opinion, but please let's be understanding, non-judgmental, and kind to each other as we face this pandemic and its many oh-so-human expressions. Many of you are now asking about opening up and when we can safely relax our public health measures. To this question, I'd like to come back to a few points I made last Friday. I will also be coming back to this topic frequently in the weeks ahead as we, like the rest of Canada, are actively thinking and planning in this area. Before I get there, one of the conditions we have been talking about for opening up, among many conditions, is testing capacity. Although we have tested a lot of people, we have been working on revisions and testing in a number of different areas. Testing in vulnerable or outbreak susceptible areas like continuing care or the shelter, as well as surveillance testing and expanding criteria for testing. It's very important that we line up all the guidelines and communications necessary to make this transition to new testing approaches smooth. But by this Friday, I will be able to give you more details on a revised testing strategy. So what will it take to get us back to normal? First, it's important to emphasize that for now, normal means new normal. There is no getting back to the old normal until we have a population that is sufficiently immune. And sufficiently immune means COVID vaccine available and injected into enough arms to ensure us that the risk of community spread is negligible. That means a long time between now and then, and our current working timeline is a year to 18 months. So what can we do within that 18-month period that could allow us some relief to the conditions we are currently living under? Well, that's where I'll be coming back to you, so that with the right conditions and in collaboration with the rest of the Canadian jurisdictions, we can prioritize areas where we can relax enough to allow for some opening up. What are some examples? Well, this will involve looking at who is affected by orders, who may be not directly under order, but whose services may be affected by current orders or restrictions, for example, the ban on mass gatherings or requirements for spacing. Examples might involve healthcare services, businesses that are either constrained or currently under orders, or recreational or cultural facilities and activities. In that vein, we have much to do yet in order to get to a place where we can safely ease restrictions. The criteria we will use involve maintaining our ability to maintain control of the epidemic. This means keeping the borders tight so that our healthcare and public health capacity continue to be able to respond to the levels of need should COVID clusters or outbreaks occur. That all workplaces are in compliance with COVID prevention practices, and that we engage fully with communities and stakeholders in our activities. All through this long period of time ahead of us, we must continue adhering to the basic 6 principles of COVID prevention: physical distancing, regular hand washing and sanitation, staying home when sick, limiting social gatherings, avoiding non-essential travel to communities, and self-isolating when required by orders. We cannot let go of these. I am beginning to observe and hear about some relaxation of these practices, and I can tell you that we will get nowhere and could end up behind the curve if we let these go. As I say, there is more to come about how we approach opening up, but though it seems like forever already, we are still early in this pandemic. We will need patience, stamina, and mutual support to get through this. During stressful times like these, we may be tempted to turning to more harmful habits in order to cope, drinking more alcohol than we might do normally, increasing smoking, or even restarting. Young people might be more inclined than usual to smoke or vape. Although the evidence is still early on, there is good reason to suspect that smoking and COVID do not mix very well. One of the more important chronic medical conditions where COVID outcomes are worse is chronic lung disease and asthma. Given the many risk factors for severe COVID linked to underlying medical conditions, we should be doing all we can to maintain optimal physical as well as mental health. It may be natural to think of reaching out for a smoke or drink to help us cope, yet when so many aspects of our life are being turned around or re-examined, this can be an excellent time to think about quitting or cutting down or getting help. One really good resource to remember is Yukon's Quit Path program, and they're ready to help you quit with resources, coaching, and free nicotine replacement therapy. For youth, we've heard from a number of parents about their who are now home with their teenagers who are realizing the depth of teens' addiction to vaping, and they may be seeking help. Sharing of vapes, something that we're already deeply concerned about, is additionally a risk for COVID transmission. And I'm concerned that with the risk of lung damage or other respiratory problems associated with vaping, that COVID presents itself as one more risk for people to keep in mind when they vape. If young people are now living more physically separate lives, which I hope they are, this might also be a very opportune time to reduce or quit vaping. For support with both smoking and vaping, visit quitpath.ca or call the numbers that are on the website or that will be provided. The Health Promotion Unit, which runs the Quit Path program, has now adapted to virtual or low-contact practice in adherence with COVID requirements and is standing by to help. The Smokers Helpline is also still available to offer phone support and advice to smokers and vapers. That's all for today's update. Thank you. Merci. Dakonuta J.
Thank you, Dr. Hanley. We'll go to the phone lines now. Marais, Aurore Boréale.
Oui, merci. J'ai une question qui concerne les garderies, les camps d'été. Habituellement, en cette période, les garderies sont en recrutement pour les emplois d'été. Est-ce que c'est envisageable de penser qu'il va y avoir des mesures qui vont être levées à la fin de l'année scolaire, donc vers le début du mois de juillet, pour reprendre les camps de garde pour les garderies. Est-ce que les camps pourront avoir lieu?
Oui. Donc, c'est une question pour les camps de garderie, les camps pour l'été. It's a question about summer camps, and I'll come back to it in English. C'est une question que je ne peux pas à ce moment donner des détails, mais c'est une question qu'on va examiner dans les semaines qui approchent. Je sais, il s'agit très important pour les parents, mais aussi pour les familles qui veulent faire participer dans les activités, s'ils sont des camps ou des autres activités. Donc, pour le moment, je ne peux pas dire, mais on va revenir avec les détails dans les semaines qui viennent. The question was about about day camps or the daycare for summer and associated activities. So this is a question I will be coming back to as we work out some of these. Some of the do's and don'ts, you might say, or the activities that we will be able to allow or be able to give more specific guidance to in terms of camp activities for the summer. So the best I can say is stay tuned, but we are working on some guidance around this.
Marie, une autre question?
J'ai un suivi. Est-ce qu'on pourrait imaginer que ce soit que les préventions qui sont faites en ce moment, comme un adulte avec 4 enfants et beaucoup de désinfection, est-ce qu'on peut penser que ce serait une des options?
Oui, donc les modèles, je pense si j'ai bien compris, c'est si les modèles qui sont couramment en place pour les garderies peuvent être suivis pour les camps d'été, c'est ça?
Oui, c'est ça.
Oui, oui, exactement. Donc, c'est ça que je pense, je suis optimiste qu'on peut avoir les mesures similaires en place, mais je ne peux pas confirmer à ce moment.
Merci. Gabrielle, Whitehorse Star.
Hi. So as you mentioned that we're looking for a year to 18 months before we get back to the old normal, we want to call it that. And there are some things that can change back or some things that can reopen. What are some of the things that can't change or will definitely remain closed or restricted in that time?
If we include border closures, for example, I think we need to maintain very tight border closures. Now, will there be some tweaking or variation? Possibly, but one of the key aspects is preventing importation of cases. As you know, all of our COVID cases have been and will likely continue to be associated with importation, travel importation. So the border measures, the self-isolation associated with travel, I see that as continuing. The ban on gatherings of 10 or more people, and potentially even some modifications to that, or how we communicate or language or provide more clarity for specific situations. I think that's, but in general, I think gatherings of people are risk factors for COVID spread. So that will also be a lens that we will apply to considering any kind of events.
Gabrielle, do you have a follow-up?
Yes, related to the border, I'm wondering what communication is taking place between enforcement officers taking declarations from people who are traveling, say, to the communities. Is that being communicated to those communities or to other departments in government?
So that being more on the EMO community measures and enforcement side, I won't be able to give you a precise answer, but I'll make sure that's noted and get back to you.
If we can move to Jane from CBC.
Hi. So it sounds like, these restrictions could be happening for another while. Alaska today says they're starting to look at opening up some businesses later in the week on a limited basis. And today, the Chief Medical Officer of Health in the Northwest Territories said it would be at least another month before they start lifting some restrictions. Do you have any sense of what limited restrictions could be happening in maybe a month or 2 months? Do we have that kind of a sense of a timeline of a new normal for the relaxed restrictions?
It's very difficult to say at this point, Jane. It's more likely to be along the timelines that my counterpart in Northwest Territories talks about at a minimum, but we will be certainly before that time be able to come back with more of a specific plan. But this is very much, again, a national discussion as well. So we're working closely not just with our northern counterparts, but other jurisdictions in Canada for establishing a framework, for establishing priorities and then reasonable timelines. Now, of course, timelines are going to vary by jurisdiction according to, and potentially even by region, according to what stages of pandemic different areas are experiencing. But at least we will have a common strategy, a common approach, and a common way of assessing priorities for opening versus restricting.
And when it comes to the restrictions, do you have a sense of how people have been following the restrictions, businesses and others? People in the community. The Northwest Territories had some numbers today about how many complaints and how many warnings have been issued. Have people been following the restrictions in Yukon? Do you have any sense of that number?
I wouldn't be able to give you data on that at this point, that I think is something that, especially as the enforcement systems get increasingly into place, and also at a point where they can actually gather some of this data, we can bring that back. I just sense there's a lot of variability in how different enterprises, businesses, companies have adapted to the measures. As you know, some may have closed, some have been extraordinarily active in putting in measures, and of course it depends on the type of business, the size, the type of business, the type of service that's being offered. So much variability, but I don't have numbers at this point.
Okay, if we can move to Gord from Yukon News.
Yes. Should your Yukoners at this point realistically expect that all measures will still be in place in 12 to 18 months?
There will be opportunities for easing of restrictions, but respecting the fundamental principles. So it's going to be just allowing us to relook at services. So an example might be some of the recreational facilities, some cultural activities or facilities. So libraries might be an example. So can you reopen libraries, but respecting the 6 tenets, the 6 fundamental places. So with time, with priority, with an ability to look at priorities and to systematically examine adherence to those fundamental 6 principles, I think we can make life a lot more bearable, as it were, or livable, by looking at where we can start to open up, but having all of those other elements in place so that we can remain in a very good position to react to outbreaks, that we have that ongoing capacity, and that we are that we can keep in a safe and responsive place. So allowing some opening up, but within that defined framework.
A follow-up, Gord?
Thank you. I don't. Thank you.
We'll move to Claudiane, Radio-Canada.
Une question en français, but I will need the answer both in French and in English. Si possible de me dire comment on décide, par exemple, qu'un gymnase, qu'un commerce d'entraînement physique puisse demeurer ouvert, mais que les campings, eux, doivent demeurer fermés.
Et donc, vous parlez des centres pour gymnastique, des centres pour... peut-être vous pouvez expliquer un peu plus pour la différence entre le camping et les centres pour l'exercice ou la gymnastique, c'est ça?
Ben oui, les gymnases physiques, là où on va s'entraîner. Donc, le Centre des Jeux du Canada est fermé, mais il y a des centres d'entraînement physique qui sont ouverts, des commerces qui demeurent ouverts à Whitehorse. Pourquoi est-ce qu'ils sont ouverts, mais pourquoi les campings, eux, demeurent fermés?
Donc, oui, mais c'est une question pour pourquoi certaines activités sont ouvertes et pourquoi certaines sont fermées. Et donc, les décisions, c'est une complexité de répondre peut-être parce que les décisions ne sont pas toujours faites pour les mêmes raisons. Par exemple, un centre pour l'entraînement peut décider de fermer sans un ordre direct. Mais les centres de camping étaient fermés selon une décision par le gouvernement de Yukon. Donc, toute décision était mise en place par des personnes différentes pour les raisons différentes. Et ça peut être des raisons privées ou des raisons publiques ou des décisions gouvernementales. Donc, avec l'encadrement qu'on propose, c'est de voir chaque endroit et d'avoir un système de prioritisation et une méthode systématique d'examiner qu'est-ce qu'on peut ouvrir sécurément et qu'est-ce qu'il faut rester fermement et qu'est-ce que sont les possibilités entre les deux d'avoir accès restricté, par exemple, limité, je veux dire. Donc, I'll say the same thing in English. And the question was around why is it that, for example, gyms and training centers are closed and are closed or open or not closed, and campgrounds are closed. And I said, I think things are open or closed for different reasons. Some are government decisions. For example, the territorial campgrounds that are made in an attempt to respect potential risks or orders or advice around spacing, whereas gymnasiums have, or for instance, training centers have not been directly closed, but may have decided to close, again, because of private reasons, either for business continuity or for difficulty in adhering to spacing requirements. So what I'm saying is that I think the future approach is to establish a framework for looking at each of these areas and being able to offer guidance, support, advice about how different areas might be able to comply with safe spacing and all of the other measures, but be able to either reopen to a limited degree, and under what conditions. So I think the hope is that we can apply more of an equal framework for all for services and businesses to work under.
Ouvrir les campings?
Pour le camping, je vais aussi revenir avec les détails sur le camping. Par exemple, est-ce qu'il y a des possibilités de réouvrir des campings, mais avec accès limité. Et donc, j'ai pas encore la réponse de la question, mais on va revenir avec plus de détails sur cette question aussi. The question is about will camping be reopened? And I think that's a question that we're also going to relook at with some time and come back with some more details on that. For example, can we establish limited access? I don't know the answer to that yet, but we will confer and make a decision on that and come back to you.
We'll move on to John at Yukon News.
Hi. My question is, I guess if immunity in the community is the bellwether for when we can open things up, is testing going to be ramped up to include people who aren't currently meeting the criteria to be tested?
So in a nutshell, yes, but the details I'll come back to you on Friday with how we're actually going to do that and operationalize that. So changing testing criteria is one of the requirements for being able to go forward with easing restrictions. That we need to have very aggressive testing criteria in place. It's one of the components of the framework for moving forward. First put forth by the World Health Organization and as part of the Canadian framework for how we can safely go ahead. So more on that to come.
John, do you have a follow-up?
Yeah. Can you just clarify if it was the recommendation of your office to delay the opening of the Yukon's campgrounds and recreation facilities?
It wasn't directly a recommendation that came from my office, but it was a decision by the Department of Environment in their efforts to do what they could to comply with the advice and recommendations that came out of our office. So I think it was done out of concern of the risks that could easily occur due to lots of people gathering in relatively uncontrolled circumstances. So I think it was a decision that was made with due prudence. And that allows us the time to come back and deliberate on what could be the conditions for a safe reopening and can we realistically meet them.
Thank you. We'll go to Tim from CKRW.
Good afternoon, Dr. Hanley. Just wanted to expand on something from Jane's excellent question in regards to borders. Julian from the Narwhal had reported, I believe it was last week, about an incident in Dawson, alleged incident in Dawson, where a couple of minors went into to a general store. Also had some information passed to me on the weekend about vehicles from Idaho and from Alaska in the Walmart parking lot on the weekend. What do you say to those Yukoners who see this and are generally, they have serious fears? What do you say to them to calm them down? What do you say in this situation?
Well, I'll say a few things, Tim. One is, of course, when we hear stories, we don't have the details, so it's hard for me to comment on any particular incident, and those so they may or may not be what they appear to be. So, for example, there could be minors who have completed their period of self-isolation and are as safe as any other to go about, for instance, entering a grocery store, as long as they've met all the conditions. So, but I don't know what the details to that actual story are. I think there is a complaints process through the enforcements around the SEMA, or the Enforcement Measures Act, through emergency measures, and if people are concerned, there are mechanisms in place for people to email a concern, to report a concern that they have, so that verification can take place.
Pat, did you say follow? I had another.
Yes, please go ahead.
Okay. Well, a bit of a separate question, if that's okay. And it's more of a clarification question that I'm sure other reporters have maybe noticed as well. Just the numbers, the testing numbers. We were at 878 on Monday and 872 on Tuesday. Can you clarify what happened? Is this an indication, or does this count like double tests that were taken earlier in the process before we went to the single tests? What happened there?
Yeah, there was just a variation from testing people to testing and to reporting numbers of tests rather than number of people, and that was really simply a process, a difference in process. That was just a function of who was doing the analysis on that day. So it just what we have come back to is, at least for the time being, a process where we report number of people tested and not total volume of tests. Both are legitimate ways of reporting, and there is some variation between how jurisdictions report it. So what you saw was just a temporary variation in the reporting, but it really reflects a difference between number of tests and number of individuals tested.
Thank you. We have time for one or two more questions. Does anyone on the line have an additional question?
Yes, Claudia, here. I'd be, sorry, Jane.
No, go ahead.
I'd be just curious to hear a little bit more about, en français aussi, s'il vous plaît, about the measures at the shelter. What is being done for the vulnerable population in terms of testing or distancing or measures or...
Oui, c'est pour... et j'oublie pour le moment l'abri. C'est quoi pour le shelter?
Refuge.
Refuge, oui, le refuge, merci. Donc, c'est les mesures en place pour le refuge. Il y a beaucoup de travail qui a été fait depuis les dernières quelques semaines pour mettre en place les mesures au refuge à Whitehorse. Et même que je suis pas tout à côté et détail, on a mis les mesures pour respecter les besoins pour la distance physique. Donc c'est selon le nombre de personnes qui sont dans l'édifice à un moment, les heures d'ouverture, les mesures pour accommoder les personnes s'il y a par exemple trop de personnes, les autres facilités ou les autres disponibilités pour accommoder les personnes. Les communications et l'éducation des personnes et des personnels et beaucoup d'autres mesures pour appuyer et pour communiquer toute l'importance des mesures. Donc, on fait le même maintenant parce qu'il y a des concerns, par exemple, pour les personnes maintenant avec le printemps et le temps plus chaud, qu'il y a plus de personnes qui ont la tendance de rester naturellement dehors. Donc, on suit ça avec les mesures pour appuyer l'importance des distances sociales, physiques, autour de logement aussi. J'explique en anglais aussi. Peut-être je vais juste continuer. I'll just continue. The question was about the measures in the shelter, and just to recap very briefly, much work at the Whitehorse shelter to put in place the requirements for adherence to the public health prevention measures such as physical distancing, at the same time to support the people that need the shelter in terms of meal planning, physical spacing, number of people admitted at a time, alternative supports for people if the building is at capacity, temporary accommodations. And now recognizing that some of the concerns around spacing on the outside around the building as the weather warms up, measures are being looked at to address that situation as well by social services, and with the support of some of our personnel at the Emergency Operations Center here, to make sure that both the supports are there that are necessary, but also the adherence to physical spacing.
I think I heard Jane also on the line. That will be our last question for today.
Yes, Dr. Hanley, I was wondering if you might be able to give a little bit of an overview, now that we've had 11 cases here, of the kind of symptoms that we've seen in the territory. I know that COVID-19 can present different symptoms, and it seems like it can be quite wide-ranging, but could you give an overview of the symptoms that we're seeing here?
Yes, and I could roughly, but it's something I could also bring back by reviewing the data. What we're seeing are symptoms that are very similar, even given the small numbers, to elsewhere. So definitely cough, headache, and fever, and then various descriptions of difficulty breathing being the predominant category of symptoms. So that's certainly consistency, but even with 11 cases, you see the occasional presence of a variety of other symptoms. So loss of taste, loss of smell, for example, has been not only reported nationally and internationally as something that, although it doesn't occur in every case, it's a quite a remarkable feature when it's especially in combination with the other symptoms, and it's also something that we've seen a number of times here.
I'd like to thank everyone for joining us today. The next update will take place Friday, April 24th at 3 p.m. Thank you, Dr. Hanley. Thanks, Mary.